Can you hear me now? Yeah.
Okay, there you are. How are you?
Oh, just hanging in there.
Oh, nice shirt.
Yeah.
Very fancy.
Throw it right in the wash when I go home.
What did you do this weekend?
Helped paint Zoe's room
Okay.
purple.
You guys did a floor project, right? You redid your floor.
Yeah, that's Dan's big project.
Okay. How'd it come out?
We just have to he has to put the baseboards back in and the washing machine. So I have lots of laundry to do.
Okay. Jeez. Well, we've been trying to find things to do. We went on a 15-mile hike yesterday. Just under 16 over to Erie. We did like the big loop that I usually ride my bike on, and I wore like running shoes versus hiking shoes, and my feet are just beaten to a pulp at this point. But I don't know. So how have the last few weeks been for you? We've talked, but I haven't like seen you literally. Obviously I'll be in the office tomorrow. I can see my desk behind you.
There we go. Okay.
There you go. I'll be there tomorrow, but what have the last few weeks been like for you? We're both seeing patients. How productive has it been?
Very productive on the mornings that I've had here having patients. Actually, today was the first no call, no show, but I've worked with her twice before without a problem. So I'm thinking it just, there's not any, I don't know if she got the reminder.
Yeah. Initially I had a lot of challenges with connection, patients remembering their appointments. And me trying to having everything all sorted out on patient management. It's a little different not treating people, but we're doing a lot of, management of their life at home. So activity, health, wellness, squirrels behind me, but it's been a challenge. But what about concussion patients? How productive is it to actually continue their care through telehealth?
Yeah, really, really productive. I've even started some patients with telehealth via who have concussions, and every week I've been able to progress their exercises and help them. Even just like you said, strategies for wellness during this challenging time, and people have time to do the exercises. So I'm finding people are kind of flying through. So we're really creative. I had one patient use some unopened mouthwash as her visual tracking. It's just being really creative. I was able to help one of my patients has neuromyelitis, which is a neuromuscular condition like MS. And she's blind in one eye and deaf in one ear, and she got hit on the driver's side by a semi. And so she had a lot of balance and vision, and even worse in neck pain. And I've been able to meet with her and keep progressing her balance and getting her more functional, and her neck pain's almost gone, headaches are gone, vision's better. So it is much better of an option than just stopping therapy altogether.
Yeah, because concussion, is relapse the biggest threat, or is it just not having continued progress? Because time is such a big factor in recovery of a concussion, I assume, but also having productive days, productive weeks. If someone went 3 weeks, can they often slip back fully, or is it they become more symptomatic? How would you explain it?
Yeah, kind of both. You don't want to just stop the running because you're retraining the neurons and the motor control, and you just want to keep progressing to the next step until we can get 100% functional. But there's also this huge emotional piece, and we see this a lot during the holidays with the overstimulation. There's just a lot of emotions going on. Some of my patients have lost their jobs and they don't have an income, and they're very isolated, or they don't have any family support, so they're just by themselves in their homes right now. And so that emotional piece kind of zaps the brain battery that we say, so that I would expect would set most of my concussion patients back, but the people I've been able to continue with telehealth are still doing better every week I've talked to them.
Yeah.
And reminding them that this, you know, some of the strategies we use for resetting the nervous system, that this is temporary, and you need to tell your nervous system that, you know, deep breathing strategies and self-talking and going for walks or doing some yoga, but tell your body that it's going to be okay, because it's not going to be like this forever. So
because we have concussion patients, and they often are very high functioning, and then they struggle at work, or they struggle, you always hear in sports where they want them to physically be decreasing their activity, but also the mental capability is affected, where what about in a time like this, even though they're home, and it should be in a weird way less stressful, because when's the last time we all had a month to sit around, you know? But how does stress play into that? Does it just light it on fire almost? Does your brain become more sensitive and you become less tolerant to other types of stress? I don't know.
I think it's very patient specific, but mostly like the stress, the more stress, the worse the symptoms are. So,
okay.
You know, lost job, don't have an income, my balance is worse, my vision is worse, like the brain isn't balancing. So now one stressor causes the other one to kind of amplify a lot, actually.
Okay.
So trying to like to be able to control what they can control, because some of the monetary situation is not in their control. Like even telling people about resources for unemployment, and like just telling people what resources are out there for them right now. I think just talking to people and knowing that they know they're not the only one, but that they can still control their concussion rehab versus emotional things are not.
What about, like, often it's overstimulation, hypersensitivity, overwhelming type like stressors on the system. But what about, like, we went on a hike in Boulder last week on my birthday, and I noticed people are getting out. Obviously, Boulder's pretty active, but there are a couple elderly people, very functional on their own, sitting on a bench, just sitting there and peacefully. But I got this overwhelming thing. If it were a head injury patient, like, even though they're home and they're not overstimulated, they're not really getting any interaction. So like I had this kind of feeling of like, well, what about hypostimulation, inactivity? You know, so many people function at a high level of stress, whether you have kids or your job or whatever situation, and then you're stuck in your house or your apartment or your room by yourself doing whatever you're doing. How does decreased stimulation affect someone? Is it kind of like a little whiplash effect? Is it a healing effect where they actually feel worse? Just like cleaning up a diet, you often feel like crap, but it's a good change. Are they healing in a way, but they don't feel better? It's a weird question, but
I feel like, yes, I have one patient and she said, well, Mary, I've been training for this for 6 years because she has such an issue with hypersensitivity and like large crowds, and she hasn't been able to enjoy and do those things because of her brain injury. So this is really not that much different as the lifestyle that she was living anyways, but able to like go out and walk and get exercise and stuff like that. But I would say it's probably more detrimental to concussion rehab because we want the brain to be exposed to certain stimulus so that it learns how to kind of deal and reprocess the information again. So staying inside all day and like the dark is going to set people back and not allow them to refire those neurons. But yes, just being outside, like, and getting some sunshine or going get some fresh air.
Some interaction with the world is still healthy.
Interaction, yes, would be still healthy. I think there's just so much fear as to like getting the sickness, the coronavirus, that people are, you know, that fear is driving them to be very isolated. So
Yeah. It's a weird world. I don't know what to do. I'm just, I haven't worked out at all. I've gone hiking, I've done housework, I've gone on a bike ride and walks, but I don't have the energy to actually move weights and lift weights. And today might be the day because it's so beautiful. But it's so weird without much to do. And I've been prompted by a lot of people to like, will you treat me? Will you like make a concession? And as much as I want us to, be busy and make money, I just can't do it for various reasons. I don't want to put them at risk and me at risk and the principal, as well as just it's a slippery slope. So, who do you pick? It's been hard to just kind of wait. So it looks like we have quite a while, but what do you think someone with a concussion should be doing in the next few weeks? Because we have months of struggling here, but a few more weeks of really being stuck at home. What is a concussion patient? What should they do?
Well, there's a lot of resources available to them to, well, if they haven't been evaluated, get an evaluation, get a treatment plan, have some direction in how to heal. One patient I had, we started through telehealth, and she had fell in the winter. I think it was November, and she slipped on the ice and hit her head. And she just really didn't know that this dizziness and balance and the blurry vision and that all these symptoms were, still from her concussion, even though it was, a while ago. So just giving information and reaching out to resources, because I think most people are taking this route at this point. So there's a lot of resources for people to look into.
Yeah, we've had, sorry, I interrupted you, but we've had troubles with people, like they have, say, neck or back pain, they're stressed, they're sitting around more, or they're more active. It's weird. People have this weird contrasting like issues, but and they're asking like, what can I do to treat myself? And I always love to show people how to do things like Graston or scraping and cupping. There's always stretching and mobilizing and moving, but we're kind of left with only a few options. I wish everyone would learn a little bit better how to physically treat themselves, take control of their body. That is healthcare. That is wellness. Don't wait till you're hurt and sick. But I think what we've told people is if they have any questions about anything, they can just reach out, email. You can do teleconference with me, but it's been hard to kind of get people to really feel the value in it. But any email has been the best way to just get direct access to me or anyone else, and we can just give you advice and hopefully get through this all together. But I don't know, what's your next plan at home? You have 2 kids, so I'm sure it's been just this relaxing. I can imagine, like I don't have kids, and I'm like, oh, I can't imagine like how it would be, because
it keeps it busy and full of life for sure. I mean, my goal was like there should not be one thing like I wanted to get done that doesn't get done around my house. Or
what about relaxing?
No, and then my other goal is that I just like needed, if I don't work out, it's like I would like to work out now.
Yeah.
And I would never work out that way, because now I have the time. So
yeah,
my goal was like to get stronger and take care of myself, because it's really hard to like squeeze that in when life is real.
We've heard a lot of parents each session I've had on like a teleconference. We go through this routine of an update of what's happening in their life, and you hear the parents talk about like all the teachers from the kids' school just are dumping the work on them. And I feel like they're going to look back, the whole system will look back and go, well, you can't just take the same material and throw it on online education. And they realize everyone's going to struggle. So parents like, I can't get all this work done with them. And I'm like, don't worry about it. They'll like, just do what you can, do the best you can. I don't think it's ideal situation. And in the end, I wonder if everyone will go back and really appreciate the teachers even more, because it's not about being critical of parents, but just the teachers have always taken the burden of trying to like shove information into these kids' brains, and they're not always attentive or able to, like, I knew I learned very differently than what we grew up with. And it is a pain in the butt, even though I did well. It was like a lot of work at home with parents, you know, and I think everyone will appreciate parents like busting their butt, but also the teachers. I wonder what will happen with youth education after this, you know?
Yeah, I mean, it's definitely been a huge frustration. Our district was not ready for this because I've talked to other friends who have like a very organized system.
Yeah.
They all had iPads before. They go to this one place. They have sheets that they do, and then they submit that back to the teacher. Where I have like 5 different emails, one for math, one for reading,
Yeah, exactly.
for all these different websites. But my daughter actually had some concussions, and she was diagnosed with ADHD, I believe, as a result of those concussions. And so I've really been able to see her struggles, which I don't know I would see before in the home setting, as far as like not being able to pay attention with like noise around her and her brother. She has to wear her earphones. We have to definitely work hard. So it's been kind of a blessing to see how she's doing and what she needs help with, because the school has done a really good job of making like a plan for her, and getting her extra help so that she can stay on track. But yeah, I definitely commend the teachers. I just think it's really hard because they're trying their best, but you know, we just shoot for 30 minutes of math, 30 minutes of reading, 30 minutes of studies, go paint the room.
Oh. My mom just retired. Like, I think tomorrow's her official last day. She retired a week or 2 ago, and I feel like I'm searching for things to do. Yeah, we have this time to get stuff done, but it's interesting hearing parents talk about teaching their kids. I feel like school systems didn't want to shove down iPads and these high cost to families and parents, but now looking back, like, the world's not going to be the same. Just the teleconference stuff we're going to utilize in our business, let alone school systems and different forms of learning. I think it's, you know, even like parent teacher conference, why didn't they do teleconference and instead of having like parents drive, you know, and take time out, or these meetings where I know even our own employees that trying to, you know, I have to go here for this, and in the busy day, you don't have to take time off from work. Like, I think life's going to become a little bit more streamlined, and in some ways it'll be better, and others we'll see. But hopefully learning for kids is going to improve. But no, I think
I could see it be really challenging to have like be working still full time from home and trying to like meet these criteria and actually help your child. I think a lot of children are probably left to try to figure this out on their own because their parents are still working from home, because I don't know what the percentage is, but a good chunk of people still are able to do that. So
or we've had patients who work in a environment where they're not closed, and their child's home, and now childcare, let alone, you know, God forbid your child has any challenge with learning, let alone equipment and other situations that affect their quality of learning. It's a crazy world. So I think you have some more patience today. I'll be in the office tomorrow, not sitting right behind you, but in another room. But it's gone well so far. I look forward to being back. I think I'm going to call you again next week, and I have more questions for you. But thank you for taking my appointment and my call. And I hope you have a good rest of your day, and I'll see you in person soon, hopefully in a few weeks. Okay. Thank you. Bye-bye.